the concept of undergoing routine examinations appears invariably beneficial. After all, the earlier a problem is detected, the better, correct? However, in practice, particularly after the age of 70, this reasoning may shift. Certain examinations, when requested without discernment, ultimately generate more uncertainties than resolutions, and in some instances lead to unnecessary or even detrimental medical decisions. Contrary to what many envision, examinations are not neutral. They can induce anxiety, yield results that confound rather than clarify, and even cause complications in otherwise healthy individuals. A finding that appears concerning may merely be a normal variation associated with age. Nevertheless, it can initiate a sequence of tests, biopsies, or surgeries that the body neither requires nor tolerates well. This is why some experienced physicians have cautioned, in later life, prevention with wisdom differs from investigation by habit. The emphasis should be on functionality, quality of life, and what truly contributes to the individual's well-being. Examinations must serve as allies, not sources of invisible risks. Recognizing that not every examination is essential is the initial step toward a safer aging process. Healthcare should be personalized, informed, and proportionate to the realities of the body and life. Sound medical judgment, combined with knowledge, determines whether an examination offers benefit or merely concern. Many examinations deemed routine are ordered automatically without assessing the elderly individual's actual context. This can lead to discoveries that, in isolation, signify no issue whatsoever, yet provoke fear, confusion, and worst of all, a series of investigations that exhaust both body and mind. This cycle is known in medicine as the cascade effect. In later life, each examination requires more rigorous evaluation as the risk of complications increases. Invasive examinations, for instance, may cause bleeding, infections, or adverse reactions in a more sensitive body. Imaging examinations, even when safe, often reveal alterations that would cause no problem, yet, once identified, they open doors to unnecessary procedures. Beyond physical risks, there is the emotional impact. A simple, altered result can generate weeks of anxiety, routine changes, use of medications without genuine need, and even preventive surgeries that offer no benefit. Excessive examinations transform health into constant surveillance, without necessarily yielding more life or well-being. The safest path is to understand that, after 70, the focus is no longer on screening everything, but on selecting what truly matters. Investigate with wisdom, act with balance, and prioritize quality of life over an obsession with diagnoses. Prevention is not about seeking everything. It is about knowing what to seek and when. Subscribe to the channel. Here you will find reliable and practical content to care for your physical and mental health. Disease prevention, tips for healthy habits, well-being and quality of life. Turn on notifications and follow our updates to live with more balance and health. Now let us continue. Computed tomography and magnetic resonance imaging are powerful examinations capable of revealing detailed images of the body. However, when performed without clear medical indication, especially in the elderly, they can become pitfalls. This is because they display minor alterations that often represent no real risk. Yet, once detected, they generate concern and unnecessary actions. With aging, the body exhibits natural variations in internal structures. A cyst, a calcification, an old lesion, all of these may appear in imaging examinations. The issue is that these findings, despite being harmless, are treated as suspicions, initiating a chain of additional examinations, biopsies, and even surgeries that could be avoided. Furthermore, to perform a magnetic resonance or tomography, contrast is often required, which can cause reactions in individuals with compromised renal function, something common after 70. Not to mention the emotional stress of being in enclosed or uncomfortable machines, particularly for patients with reduced mobility or anxiety conditions. These examinations should be reserved for cases with concrete symptoms, a justifying clinical history, and a realistic expectation of benefit. When used judiciously, they are health allies. But outside the proper context, they can initiate a path of invisible risks that were not present before the image was taken. Undergoing heart examinations seems invariably a sound idea, especially after 70 years. Nevertheless, in individuals without symptoms and with good functionality, certain cardiac checkups may pose more risks than protection. Stress tests, scintigraphies, and preventive catheterizations, when performed without clinical necessity, expose the elderly to invasive procedures that do not always yield genuine benefit. The heart ages, indeed, but this does not mean it requires constant scrutiny for silent issues. Invasive examinations can provoke arrhythmias, adverse reactions, and in some cases, even hospitalizations. Moreover, intermediate or inconclusive results typically lead to more tests, medications, or surgeries that the patient might never have needed. In contemporary medicine, the focus is not on identifying diseases that may never cause symptoms, but on treating what affects the patient's real life. If the elderly individual experiences no pain, no shortness of breath, and maintains an active life, the approach should be more conservative. The risk of an examination may exceed the benefit of discovering something that would not have a direct impact. Therefore, heart care should be based on symptoms, history, functionality, and simple examinations, such as blood pressure, cholesterol, and electrocardiogram. Intelligent prevention is that which respects the balance between investigation and protection without generating harm in the name of a potential future risk. Not every cancer screening makes sense after 70. Certain examinations, such as those for prostate, breast, or bowel, may generate more risks than benefits if performed in asymptomatic individuals with limited life expectancy. Modern medicine already discusses this with clarity. The issue is not the examination itself, but what it may initiate: biopsies, surgeries, hospitalizations. Many of these procedures are overly aggressive for a more aged body, and in some cases, the discovered cancer would not cause harm during the patient's lifetime. Furthermore, the emotional impact of a diagnosis can compromise quality of life. Fear, anxiety, and intensive treatments may outweigh the problem itself. Therefore, the decision to screen must be personalized. Screening is useful when indicated, but screening by habit, without assessing risks and contexts, can transform prevention into suffering. Sound medical judgment determines whether an examination brings peace or unnecessary concern. Incidental findings are unexpected discoveries made during examinations requested for other reasons. A nodule, a spot, a subtle alteration. In most cases, they are harmless, but once found, they are rarely ignored, and that is where the problem begins. Even benign alterations end up generating new examinations, specialist consultations, biopsies, and often surgeries, all in an attempt to avoid risks, even when the actual risk was minimal or non-existent. This is a so-called cascade effect. In the elderly, this effect can be dangerous. Each new examination or procedure demands from the body, generates anxiety, and consumes energy. Often, health deteriorates more from the sequence of interventions than from the initial discovered condition. Avoiding the cascade effect is not denying examinations, but understanding their true purpose. The right examination at the right time is an ally. Excessive examination, on the other hand, can open doors to treatments that would never be necessary. Before accepting an examination as routine, it is important to ask, will it change any decision in my care? This simple reflection already avoids many unnecessary indications. Not every examination leads to a useful action, and many results do not affect medical conduct. Another essential point is to consider life expectancy and functionality. An active, independent, elderly individual with good health may benefit from certain examinations. In frail individuals or those with advanced chronic diseases, the risks of investigation may outweigh the gains. It is also important to evaluate the preparation required for the examination, the involved discomfort, and the possible effects after the result. Some tests require fasting, anesthesia, contrast exposure, or movement that can be exhausting. The decision should be made jointly with the physician, based on evidence and aligned with the patient's life objectives. A good examination is one that informs clearly and generates actions that promote well-being, not just numbers or images. Good medicine in later life is not based on an excess of examinations, but on well-made choices. The body changes, the pace slows, and priorities transform as well. Prevention remains important, but it must be adjusted to each person's reality, with less haste and more purpose. The right examination is one that aids decision-making, improves quality of life, and respects the organism's limits. When performed judiciously, it guides care. When done by routine, it can disrupt everything. Knowing the difference is what makes care more intelligent. At 70, 80, or 90, health is not merely the absence of disease. It is functionality, clarity, autonomy, and tranquility. Examinations can be powerful allies, provided they are used with wisdom and, above all, with respect for what each body truly needs. If this content has helped you reflect, take the opportunity to watch the other videos on the channel appearing on the screen. They offer practical guidance for living with greater awareness, security, and balance, because health, in this phase of life, begins with good decisions.